Welcome to our webinar, Understanding Childhood Trauma. My name is Tammy Shamoon. I am the co-founder of the Institute of Child Psychology. I'm a registered psychologist, a registered play therapist, and a registered play therapist supervisor. So today we're talking about a really heavy topic. And it's one that I think deserves a lot of attention in our society, and it is often overlooked in terms of how many children are suffering in silence with this. This has been an area of specialization for me, along with anxiety. We have a free webinar that I've given on that as well. And I have been utilizing play therapy and animal-assisted therapy, as well as EMDR. It's a type of eye movement desensitization and reprocessing therapy to help children and teens impacted by a multitude of types of trauma over the past several years. So this webinar is really going to speak to what is trauma, what happens in the brain when there's trauma, and I will give you a few key tools to get you started, and we'll kind of go from there. So, what is trauma? Traumatic events are extraordinary not because they occur rarely, but rather because they overwhelm the ordinary human adaptations for life. That's Dr. Judith Herman quoted that. Trauma comes in many, many phases. And what's traumatic to one child actually might not be traumatic to another. So we can't just use situations to determine if something is traumatic or not. There's also different kinds of trauma. We have small t traumas and big T traumas. Small t trauma might be cumulative bullying over a long period of time. Maybe a parent suffering intermittently from mental health disorders. Whereas a big T trauma is maybe a child being sexually abused, or severe neglect, or a car accident, or an incident, a single incident at school. Maybe there's a school shooting. So it can be many different things, and you can have two children and have the exact same incident happen to them, essentially, and only one of them will experience that as traumatic. Now, why is that? Well, there's lots of different reasons. There are protective factors that go on. Some children simply have a better social support. It depends on when the trauma happened, the attachments in the child's life. If it happened once or it happened multiple times, if that child had a chance to talk about what happened or express what happened to them and process their feelings or not. It depends on their temperament. It depends on levels of resiliency, levels of grit. All of these things will determine how a child is impacted by this. So we can't just maybe naively assume that this one type of incident is going to equal post-traumatic stress disorder. Now, talking about PTSD, post-traumatic stress disorder, when I say trauma, it doesn't necessarily mean PTSD. PTSD, post-traumatic stress disorder, is a very specific diagnosis used by psychiatrists, psychologists, doctors, and other mental health and medical professionals. Just because a child has suffered, say there was a house fire, or they were molested, doesn't mean they necessarily will meet the criterion for PTSD. But that doesn't mean that the child isn't impacted emotionally by the incident. And when we talk more about the neurology of trauma, we will start to see it's when the child is severely impacted by these negative events that where they're perceived at some point during this event, they perceived themselves as unsafe and threatened. And it compromises the stress response system in the brain and in the body. And we'll get into that as we go. So really, we're talking about the individual's perception of what's happened, their emotions around it, and how the brain is rewired as a result of the trauma. So what will happen is children who do experience something as traumatic, it will change their developmental trajectory, their ability to regulate their feelings, to communicate, to think, which is, we're really going to see issues often around executive functioning. If you're a teacher or work in education field, you'll know that has to do with planning, remembering, learning, reading social cues, things like that. And it's very common for kids with post-traumatic stress or just your everyday trauma to struggle in an academic environment. So what will happen with a child who has been impacted by trauma is it will change the brain in such a way that they won't respond to the environment like an atypical, neurotypical child will. I think what we have to remember about our brains, we have been evolving as a species for over 2 million years. And it is only in the past few thousand years that we really have started to live in societies where we're in housing. We're not living necessarily outdoors. We have all of these really big advances in terms of technology, and we have food sources readily available. And that's not always the case either with families. But because for so many years, we lived in the elements. We had animals like saber-toothed tigers. We had avalanches, droughts, all these things that we had to be cognizant of all day long. Now, some of these things, obviously, some people still have to endure, but our lives used to be much more stressful when we, of course, lived out in the open. We didn't have houses, we didn't have cars, all those things. And so our brain has developed over these 2 million years to keep us alive at all costs. And while the brain can do amazing things, it can build computers and skyscrapers and write sonnets and music, ultimately, its number one priority will forever be to keep us alive. And when that mechanism in the brain is compromised through trauma, you are going to see a child who is constantly surveying the scene to see and to gauge if there is a threat. And we'll talk about the mechanisms in the brain that do that. So I think what we have to do as the caretakers or clinicians or parents of these children who have experienced trauma is we have to accept that while in the moment you're working with them, they might be safe. They probably are safe. You're not going to hurt them. You're trying to give them predictability, and you're trying to calm them down. You're trying to love them, whatever that is. Their brain is stuck in a past experience. They're reliving an overwhelming past that they haven't processed yet. And until a time where they can process what has happened, they keep kind of going back to that place. It doesn't always mean that they remember it per se, but their body remembers it. There's a great book called The Body Keeps the Score. I highly recommend reading this book that talks about how the body remembers trauma, even when the mind doesn't necessarily, when we talk about autobiographical memory. So just to think on that. Now, I would really encourage you, if you're interested in working with trauma, you have a child who's traumatized, you're an educator, is to look up the ACEs study, the Adverse Childhood Experiences. In the 1990s, Kaiser Permanente, along with a few other researchers that I can't think of at the moment, conducted this study that has completely overhauled the way we look at trauma. And of those adverse childhood experiences, they kind of categorize it into abuse, neglect, and household dysfunction. So children who grew up with physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, and an incarcerated relative, a parent was treated violently, substance abuse, or divorce, they would be, though each one of those incidents is considered an adverse childhood experience. And the more ACEs you have, the higher your risk for a multitude of issues later in life. And I think this is why it's so important that we acknowledge trauma. I'll give you a few statistics here, but we know that trauma in children is related to later in life, and sometimes in the present moment while they are the aftermath is happening, is related to obesity and a lack of physical activity. You're more likely to smoke, drink, use drugs, miss work, develop diabetes, depression. You're more likely to commit suicide, develop STDs, to have cancer, to have a stroke, to have asthma, to have allergies, to have COPD, to break your bones, heart disease. It's a multitude of things. In fact, it literally changes your DNA, how your DNA is transcribed, as it turns out. If you have 4 ACEs, so remember 4 of those pieces that I talked about, those incidences in your childhood, 4 ACEs would be, let's say you had divorce, your dad was in jail, you were neglected physically and neglected emotionally. That would be 4 ACEs. That's an example of a combination of 4 ACEs. Your chance of suicide would be 1,500% higher than a child who did not experience 4 ACEs. You have a 550% increased chance of alcoholism, liver disease, COPD, and asthma, and you're 4.5 more times more likely to develop depression. If you have 7 ACEs, you are more likely to die 20 years earlier than other people. You have a 3.5 times higher risk of heart disease and 3 times the risk of developing cancer. So this isn't just a mental health issue. This is a health issue that, thanks to epigenetics, when we have high amounts of stress and the stress hormones in our body called cortisol and adrenaline, especially cortisol, and toxic levels, it literally changes not only our mental health. It literally changes the amount of our brain mass. It changes how our brain is wired, and it changes our genetics. And especially we look at in terms of disease, that if you already have the propensity to develop cancer in your family, having a trauma essentially triggers the onset. It doesn't have to, but it can trigger the onset of autoimmune disease, cancer, things, heart disease, things like that. So something to consider when looking at trauma in terms of its toll even on our healthcare system. What are some experiences of trauma? Because that get asked a lot, and I think that's a complex question, but I'm going to list some of the top ways in which trauma is experienced in children and teens. So we have physical, sexual, emotional abuse, neglect, which often gets overlooked, children who are physically or emotionally neglected by their caregivers, witnessing or experiencing violence, car accidents, physical injuries, surgical or major medical procedures where it's, I think that's traumatic for a lot of people. The uncertainty and being separated from their caregivers is massive, and the not knowing what's going to happen next with the diagnosis. Loss of a parent or caregiver, such as the death of a parent, or in the case of a divorce where they did not get to see the other parent. Even the threat to losing a relationship can be very difficult for children. Intergenerational trauma, which means when trauma is passed down from generation to generation, and high conflict divorce. That's an area that I work in, such as parental alienation, can be very traumatic for children when they are told they cannot love another parent. They're essentially poisoned in terms of their belief about the other parent. There's a lot of shame. They're told the other parent is bad, things like that. But I encourage you, if you want to know more about that, to look up parental alienation. Now I would like to talk to you about how trauma impacts the neurology of the brain. That then later will make sense in terms of children's response to trauma. So like in all of our courses, if you have attended or any of our webinars, we always talk about the brain and hand model, or the triune model of the brain. That the brain is essentially broke up into three sections. So and it develops in this particular order. So you have the brain stem, which is at the base of the brain, that develops first. In most cases, this is fully intact when a child is born, unless they have had neonatal trauma, which means when developing in mom's belly, they were impacted, for instance, by a genetic disorder or drug and alcohol use or anything like that. Maybe mom had issues around malnutrition that can cause damage to the brainstem. But in your average child, you will see this fairly intact when they're born. Once that develops, immediately we start to see the limbic system develop. Again, we want, this has to happen in this order. So once the brainstem has kind of done its thing, we move on to the limbic system. And that's kind of the center of your brain. It's the safety mechanism of your brain, and it's the relationship part of your brain. So the limbic system is essentially in charge of relationship and keeping you safe. Your end, which is, in the best way to put it, is your emotional system. Emotions are meant as biofeedback. Our emotions give us information about our environment. They tell us if we need to stay in a situation or move away from a situation, if a person is good for us or not so good for us, if this is a good activity we should be engaged in or a dangerous activity. It gives us lots of information about our environment. And that's what the limbic brain does, essentially. Then once that is fairly well developed, which is about done developing around 7 or 8 if everything goes okay, right towards the end of the development of the limbic system, we see development of the cortical brain. So usually in a child who's experienced a fairly healthy environment, you'll see this start to happen between 5 and 7 years of age. And then that limbic system's done developing around 7 to 8. So you can kind of see how that happens in order. The cortical brain is very important especially when you're trying to understand trauma, in that it is the logical thinking, learning, and behavioral inhibition part of your brain. It's a part of your brain that says, this isn't a good choice for me. It is the part of your brain that allows you to sit down and write an assignment if you're a student, to learn, to remember, to read social cues from other people. It's very unique to primates, essentially, and human beings alike, primates. And we will see this, essentially, the cortical brain is very compromised in children who have experienced trauma. And this is going to make more sense when we talk about the amygdala in the limbic system. So again, we've got the cortical brain, the limbic brain, the brainstem for the triune brain model. Now this amygdala. So let's borrow from Dr. Daniel Siegel and Dr. Tina Bryanson. They developed, I think it was Dr. Daniel Siegel, but I know Tina has done a little work on this as well. So when we think about, this was your brain, we think of this as your spinal cord. This is your brain stem. The center, your thumb, would be your limbic system, your emotional brain, and your survival responses that work collaboratively with the brain stem. And then this is your thinking brain, your cortical brain. So if we look at this knuckle here, there's the amygdala, and then you have the hippocampus. So amygdala is the one I want to talk about. The amygdala is essentially the watchdog of the brain. It's the part of the brain that surveys the scene to ensure you're safe. When there is a threat to your environment, the amygdala sounds the alarm, and it causes you to go into something called fight, flight, freeze, collapse. Some people just say it's fight, flight, freeze, and for this webinar, I'm going to talk about the collapse response as well. So that watchdog is always, its job is to be a little bit paranoid, to keep us safe, to always be surveying the scene. And again, when there is a threat, something scary happens, something harms us physically, emotionally, whatever that is, it will set into action the downstairs brain, the brain stem, which is in charge of the central nervous system. Your brain stem really is about your heart beating, your lungs, your blood pressure, blinking, your immune system functioning. They're things you don't have to think about in that brain stem. So when the amygdala sounds off, your body responds. And it responds in such a way that you will go into that fight, flight, freeze, collapse. Imagine we were being attacked by a cougar, for instance. I'm in Canada, so we have cougars. You want to make yourself big and you want to fight it off to save your life. On the other hand, you also have this other innate response, which is to freeze. So maybe we see this response in deer, for instance, or gazelle, where when they think they smell or hear a predator, the first thing they do is freeze to kind of survey the scene. We see this freeze response if we were being attacked by a bear, we're supposed to play dead and just freeze in place so the bear loses interest. We also see the flight response, which is, we run away. Imagine there's an avalanche and you want to take off to save your life, to get out of the way. And then you also have the collapse response, which is essentially playing dead, playing possum, or in the trauma world would be dissociation. We see this if the gazelle, for instance, it's beyond just freezing. A collapse response is so with the bear, we want to freeze and maybe play dead. With the collapse response, you check out of the situation. Your body goes into shock, and the idea is you don't want to feel yourself being eaten, and your body sends off all these endorphins, and you physiologically, emotionally, psychologically just kind of are out of the situation. And this is often where people talk about like they were floating outside of their body, they don't remember things happening. That's part of that collapse response. So when that amygdala is really under siege, you will see kids and adults alike, and most mammals and other animals go into this fight, flight, freeze, collapse. And every child is different in their anxiety response. Now, this threat response system is not unique to trauma. It's just something that has been developed in most animals in order to survive the elements, survive predators, whatever that is. So when you're working with a child of trauma, you have to ask, are they in fight, flight, freeze, or collapse? What's interesting about kids who've experienced trauma is the collapse response is often missed because dissociation can be very subtle. We often see this with kids who are coded ADHD inattentive subtype. So kids who are constantly daydreaming, they can't pay attention to what's going on, they have a hard time remembering. And it's not that they have an ADHD diagnosis, although it looks very similar. It's often it's a misdiagnosis. It's that they are dissociative and they can't be there in the moment because they're so overwhelmed. So again, this is just one way that people see it. So what we have is when the amygdala is hijacked, we see this fight, flight, freeze, collapse response. If a child has enough of this amygdala, now a little bit of the amygdala firing is what keeps us alive. It's a very good thing. We don't want to get rid of the fight, flight, freeze, collapse response. But if that system gets activated for prolonged periods of time, and it happens over and over and over, the amygdala is kind of like it's a muscle. And the more you use it, the bigger it gets, and it goes off more easily. When I teach my full trauma course, which is normally a full day, you would be with me if I was teaching it, I almost say that the amygdala is set off more easily because it has been threatened more often. And it sends off false alarms sometimes. Because it's so easily activated, it's become what we call sensitized. And because when trauma is intermittent and it's not predictable, it creates a nervous system that is overly sensitive to stimuli. And with the trauma then, it's like the child's walking around stressed out as it is, and it doesn't take very much to set the child off. And sometimes we have what's called the burnt toast phenomenon, where the amygdala fires off like a smoke alarm, but instead there being a fire in the house, it's just burnt toast. But the child thinks because of their trauma history, their amygdala jumps into action much more quickly than the average child, and it can make really big mistakes. But ultimately, the brain is just trying to keep this child alive, is the best way I can put that. The other thing to understand, so we have an overactive amygdala that essentially sets the child into survival response. And when that happens, what we'll see is a child who has some executive functioning. Their upstairs brain has already started to form. What we will see is disengagement from the downstairs brain from the upstairs brain. So Dr. Daniel Siegel calls that flipping our lid, which means the two parts of the brain are no longer communicating. So the fight, flight, freeze, collapse response hijacks your brain, so you no longer can access the logical, linear thinking part of your brain that reads social cues and allows you to pay attention and make good choices. Now, it becomes even trickier, because if that we want a child to have a very well-developed upstairs brain. That makes sense, because then they'll be good learners and they'll be good friends and they'll have impulse control and they can regulate their emotions, because turns out this upstairs brain also regulates feelings. So if a child is consistently experiences trauma, that amygdala is over activated frequently and probably in an unpredictable manner, what we see is children, especially who've experienced developmental trauma in the first 7 years of life, 5 to 7 years of life, we will see damage to that upstairs brain. It won't have any time to develop, simply because all the resources of the brain are spent on the downstairs brain. That amygdala going off and firing and firing and firing, it has no chance to relax to allow development of the more sophisticated functioning of the brain. So here you will see how the brain on the right here is, you see deficits to that cortical brain, that upstairs brain. You will see children like this who have had severe, especially developmental trauma early on, will struggle in school. They'll struggle with memory. They'll struggle with concentration, reading social cues. They will struggle with explosiveness or a strong flight response, probably a lot of mental health issues, like I said, impulse control, having a hard time making good choices. Now, the other way that the brain is impacted by trauma is through the left and right brain. Now, the brain is broken up into two different hemispheres. You have the left and the right. The left is all about logic, linear analysis, language comes from here, and your right side of your brain is all about emotions. It's about regulation, rhythm, feelings, artistic ability, creativity, empathy, intuition, those kinds of things. And those both need to be developed together. And they're connected by something called the corpus callosum, connects the right and left hemisphere. And so what we'll start to see are, when children experience trauma, you will see deficits significantly in terms of that right brain, especially damage that happens there. Damage to the corpus callosum, an underdeveloped right brain, and this results in the two hemispheres not communicating properly. And children or adults, because this will impact adults with trauma as well, as they grow up, you will see them go to either one side or the other. They're either going to be completely removed from their emotional experience and almost dissociative with their emotions, not understanding what goes on in their body, disconnected from feelings, words, unable to recall things from their childhood. Or you see a very reactive person who gets very imbalanced and gets very much in this reactive, chaotic, unpredictable kinds of behavior. So it can be, children from trauma can be experienced as very rigid thinkers and very dissociative from their feelings, or very overly emotional, sensitive, reactive kind of people. There isn't a lot of balance between that left-right brain functioning. So again, we have this specialization to fear. And because the traumatized child's brain is in a survival response most of the time, because of that history of the amygdala being activated over and over and over. Now, what this kind of leads to is something called externalized, internalized behaviors, this hyperarousal versus hypoarousal. Now, all of you will be very familiar with what's called the hyperarousal state. That's your fight-flight response. That when the amygdala is activated, children with a lot of trauma will be chaotic, overwhelmed, outbursts, anger, rage, aggression, those kinds of things. But what often gets missed is the dissociative and the freeze response. So when that child has had too much and their trauma memories or the environment overwhelms them over and over and over, and the brain says, I've had enough, I can't handle this anymore, they go into a freeze or collapse response where they shut down. They can be dissociative. They look like they're daydreaming all the time. They can't focus, pay attention. They don't express emotion. They're very flat. Those pieces. And often that is missed because these children aren't necessarily a problem, but they're just not engaged in their world because their brain is so big into self-preservation, it just shuts everything down. So you have this fight, flight, or the freeze collapse. So that's kind of your continuum. And you can go through both. You can have a person who goes into fight, flight, and they stay there for a while, and their bodies get exhausted, and then they will go into freeze collapse. Or sometimes people just stay in one or the other. So it's kind of a spectrum. And sometimes we move on that spectrum or we stay at one end of the spectrum, depending on your history, how these behaviors helped you survive your trauma. All of these things will be taken into account. So with trauma, often with the externalized and internalized kind of behaviors, you often see many mental health diagnoses are a result of trauma. And so you see, again, a misdiagnosis. I call trauma the chameleon of mental health disorders. Often it's very common for kids, and not always, but I'm never wanting to make a blanket statement like that, but it is common in our field that a child, if you don't know about their trauma history, they often get coded with oppositional defiant disorder, conduct disorder, depression, anxiety, ADHD, things like that. Now, does that mean every case of ADHD is trauma? No, that is not what I'm saying. But you'll see a comorbidity that exists between the two. So I always say before you ever take a child into a psychiatrist or psychologist, what they should be doing is taking a very thorough trauma history. And this is where that ACEs, you can actually take for instance, a multiple choice quiz to look at the adverse childhood experiences, because those often involve some trauma for kids. So now you know just a little bit about what trauma does in the brain. There's actually more that I'm not getting into because we only have 45 minutes to go through this. Please understand that there are issues around encoding of memory, fragmentation of memory, issues around gray matter, issues around the pituitary gland. The brain is impacted by trauma in a multitude of ways, but we just don't have time to go over all of it. But with the amygdala, I think it's important to understand how that impacts the cortical brain is underdeveloped, and you see issues around integration between left and right hemispheres. Now, when we work with trauma, I want to give you just a little bit of insight as to why we do what we do. If you are a trauma-informed therapist or clinician, this is, I believe, the evidence-based modalities and ways that we work with trauma. Now, this diagram you're seeing comes from Maslow's hierarchy of needs. That this is the order that our needs need to be met before we can get to the top order needs. That first of all, we need our physiological safety and belonging and love needs met first. So we can't get to the learning objectives, kids doing well in school, achieving their full potential, being accomplished, making deep, meaningful relationships, unless the child feels safe, feels secure, has all of their physiological needs met, and can experience safety with their attachment figures. It's just not the way things work. We have to kind of, just like how the brain is developed, we need to deal with children at their basic needs first, and then we work our way up the ladder, essentially. As a result, and this is thanks to the work of Beacon House provided this diagram, and then this came from the work of Dr. Bruce Perry, who's an expert in the field of trauma, childhood trauma. He is a psychiatrist and a clinician and a researcher. And because we have this developmental, the triune brain model, it turns out that treatment has to happen in this order too. This is the way the brain develops. So we don't jump to children who have experienced trauma to the cortical brain by giving them positive thinking and by giving them, 5 positive thoughts for every 1 negative thought and talking about what happened to them. Because that isn't how the brain works. That's not how information flows up through our system, even with a child without trauma. So if we're going to work with trauma, we start with the base and we move upwards. We call that a bottom-up approach. And I almost always recommend a bottom-up approach in treating trauma, even in adults. So we start with the brain stem, then we move to the limbic system, and then we move to the cortical brain. And this especially is important when we try to think of how the child's brain was impacted by trauma. If you want to learn more about this, look up Dr. Bruce Perry's work. But our first step is always to help regulate the fight, flight, freeze, collapse response by regulating the body. And then we ensure that we relate and connect the child first. And then we can support them in, their learning processes, remembering, articulating, using language and things like that. But I would really encourage you not to start from the top and move your way down. You're going to hit wall after wall after wall. We want to start, so I often say with regulation, we always start with the child's environment first, making it predictable and creating a sense of rhythm in their environment, with making sure they're scheduled, making sure they get the same response from us in a predictable way, making sure they're fed at certain times, go to bed at certain times. They know if there's going to be changes, they're warned ahead of time. With child, especially children who experienced early developmental trauma, they will have issues around that brainstem functioning, and they need that brainstem that's in charge of the central nervous system to be calmed, so then they can engage with you in relationship, which is the second step, which is we connect through attachment and relationship. Then we can do the more sophisticated pieces. So I always say when I teach my full course on childhood trauma, I say that the evidence-based solution for healing is attachment and relationship. Of course, there are strategies that we are going to use, especially when healing that left-right brain integration. But without this piece, I really feel the treatment is completely futile. Children who have experienced trauma have experienced a world that is unpredictable, unsafe, and they weren't protected. So until that time where the child feels protected and loved, they can't move forward with any other type of healing. And so it is when that child has an adult in their life who loves them, is predictable, the child knows what to expect from them, that child feels that that relationship is a safe haven, that adult supports their exploration, and then when they fall apart, the adult consistently is there for them and isn't a source of wounding and more scary feelings of overwhelmment, then we start to see that brainstem and limbic system start to heal. And when that starts to heal, we see the more executive functioning parts, the cortical brain, start to grow. So just because the brain is damaged by trauma doesn't mean we can't heal it, but we have to heal where the original wound happened, which is the brainstem and the attachment system. So we definitely want to focus on relationship. And one way we do that is through what's called the mirror neuron system. Mirror neurons, I encourage you to Google this. There's plenty of YouTube videos about the mirror neurons. But when we can be in sync with our children or the kids who are in our care, and we can mirror back to them their feelings, we mirror back their experiences, we stay with them in their hard experiences, it starts to co-regulate their bodies and their brains, and they start to relax into you. That's how empathy starts to form. That is how they start understanding other people's emotions and connecting with other people, because kids with severe trauma have a hard time connecting. We say that when our brains are naturally wired for connection, but when trauma happens, it rewires them for protection. So they can't engage with people. It's difficult for wounded people to engage in healthy relationships. So we want to make sure that when we engage with, we want to create that environment that is predictable and safe, and they know what's happening next. And then we want to make sure we're attuned to these kids, that when we are in sync with what they're feeling and we can mirror back to them and we validate their feelings and we don't punish them for having feelings. Remember that we're talking about feelings, not behavior here. Their feelings are always legitimate. And their feelings need to be there because that is what's kept them alive up to this point. When we can attune to them with those mirror neurons, we start to see healings. That is the start of healing for these kids with traumas through that attunement process. But understand that because that amygdala has been impacted, these kids are not going to be able to always control what happens. That's to think that children with trauma have ability to regulate undermines the science. Remember, I showed you those two brains, that the trauma rewires the brain for protection, and also we see deficits to the part of the brain that's involved in emotion regulation. So it's not uncommon for these kids to just act before they think. They just don't think. They are impulsive. They can be volatile or unpredictable in their emotional system. So we will always see this piece come up with kids to varying degrees, to be fair. So when we're really working with trauma, we want to ensure that we have an attachment-focused intervention. Routines, your emotional management as an adult, because if you can't keep your lid on, that's the cortical brain, how are you supposed to help regulate these kids? Your job as the caregiver is to be the upstairs brain for the child, because their upstairs brain is damaged by the trauma. So you have to be the one that manages the feelings and help them understand the feelings by engaging that mirror neuron system. We have to be attuned, and we have to use praise and reinforcement as they move along in their trauma treatment, celebrating their successes, noticing when they're coping well, noticing positive changes in their demeanor and their emotion regulation. Those pieces can be great. So again, when we're calming, remember we start from the brainstem, limbic system, upstairs brain. So we want to calm the brainstem first by producing rhythm, predictability, and giving small amounts of control to the child. So do you want the red cup? Do you want the blue cup? Do you want to have you can do your homework at the kitchen table, or you can do it at the counter. Do you want a chocolate chip cookie or an oatmeal cookie? So kids who have had trauma have experienced the world as being very out of control for them. So one of the simplest ways is giving them small amounts of control. That doesn't mean we give in every time. They still need discipline, but they need to feel somewhere in their life they can have that some kind of control back, and that will help the brainstem regulate. There's also some grounding techniques. Like I'm giving you just a few techniques. I need all day with you to go through this course, but guess what? We have just under an hour to get through this webinar. So another technique is the 5, 4, 3, 2, 1. So when you see a child start to spin, to spiral, I mean, they're hopefully not in a full out fight, flight, freeze, collapse, but you see them getting agitated. Ask them for 5 things that they see, 4 things that they feel, 3 things that they hear, 2 things that they smell, and 1 thing that they taste, and have them do deep breaths while they're doing it. That's a grounding technique. You can also use bilateral movement. This you can find this in Brain Gym is a great resource for this, especially if you're an educator, by taking a hand or knee from one side of the body and moving it to the opposite side of the body, as in the diagrams here. Also by throwing a ball with one hand and catching it with the opposite is another way. This helps integrate the left and right brain, because often kids get stuck in the left or stuck in the right when they have trauma. Distraction can be good if they're feeling a little, you can see them starting to flip the lid, but they haven't gone there yet. I also love using something called managing big feelings by using a butterfly hug. So butterfly hug is where we take our thumbs, we cross them here, we put them on the chest, and we do some very light tapping. And you would do this while the child thinks about a very happy, calm place. And I would really suggest you Google this more to get into it. But I often have kids close their eyes and talk about a place. It could be a real place or an imaginary place, but a place where they have felt safe and secure. And as they close their eyes, they tell me what they see, what they smell, what they taste, what they hear, and what they feel. And then we come up a name for this place. So it could be grandma's house. It could be summer camp. It could be their bedroom. It could be anywhere they want. It could be an imaginary place they saw in a video game. I don't care. And as they go into their calm place, they close their eyes and they do some light tapping. Again, they're not hitting, but it's a very light tapping. They can also cross their arms and tap on the sides of their knees, works well. We use this kind of processing, it engages right brain, left brain, right brain, left brain in terms of treating trauma in EMDR therapy. So that's where this kind of gets borrowed from, is eye movement desensitization and reprocessing therapy. I would also encourage you, if you're working with a child with trauma, to not use seclusion. These kids already feel scared that keeping them locked away in their room is going to exacerbate the traumatic response. That doesn't mean that we don't sometimes have to keep kids, if they're hurting themselves or hurting you, that sometimes there is times where we have to move them away. But if we can, stay close, even if it's on the other side of the door. But as long as you are safe, I would really recommend you stay with a child who is in fight, flight, freeze, collapse. Even if they try pushing you away, try staying in there. So Google time-ins versus time-outs. I like the model. You can go ACT or CAT, that when children are having big feelings, again, we don't leave them alone. We use, and maybe that their big feelings are causing their behavior to be very impulsive and they're not listening. Rather than being very punitive, I just use a simple model, which is acknowledge the feeling, communicate the limit or target it, and then target an alternative. You can also communicate the limit, then acknowledge the feeling and target an alternative. Either or is fine. You can either use CAT or ACT. But the idea is it's very simple. We don't use too many words, and we're just to the point, and then we stay with the child as they will probably have a meltdown, and that is okay. The more we stay with them, the more they realize that you can be trusted, that the bad thing that happened isn't going to happen again, and you are a person that is reliable to stay with them and not another source of hurt for them. And some kids who have a really strong fight response or very aggressive, please understand that it is not personal. It feels personal, but those kids are in a state of pain and fear, and the brain thinks it's a bear is attacking them, and they are just trying to survive the attack. Remember, they're stuck in the past. They're not in the present. They're having, sometimes we call them flashbacks or regression. We don't want to personalize it or engage in power struggles. We just want to ensure that we use like the CAT or ACT way. Keep yourself safe, keep your child safe. So as we end this webinar, I gave you just a couple tools on what you can do. I have so many more tools for you. But I just want you to remember how difficult trauma is, not only to be the one experiencing trauma, but to be on the receiving end of it. And many of you have experienced trauma yourselves, so you know what that is like. I myself got into this work because of my childhood and the amount of ACEs that I experienced myself growing up. In quite a wounding environment. And so I just challenge you, when you're working with these kids, despite their presentation, how difficult it can be, and how it's going to test you in every human way you've ever known. Consider, instead of saying what's wrong with you, ask yourself what happened to you when you work with these kids. Keep an open mind and an open heart when working with trauma. Understand that connection is one of the evidence-based treatments, is how we work with trauma. There's all these different ways, different therapies like play therapy, animal-assisted therapy, EMDR, sensory motor therapy. There's lots of different types of therapy. Art therapy can be wonderful for treating trauma. There's all these different ways we can work with it, but at the end of the day, 70% of the outcome of the therapy is going to be determined by the strength and connection with the parent, the caregiver, or the therapist. That connection is evidence-based, and you don't need letters for this. we are hardwired for connection, and our deepest fear for most of us as human beings is disconnection and not belonging. So if you can give a child who has experienced trauma that gift of connection, that's 70% of the work. You've already done it. So our most powerful tool we possess for changing behavior is the relationship that we have with the child. I just wanted to thank you for your time today. I want you to know that this is difficult work to do. And I'm so thankful that you are an adult who wants to learn more about trauma. Maybe you're going to teach someone about trauma, and you are going to walk a child through their healing process. We need more people trained and informed on trauma, what it does to the body, how it affects children, and how to help children recover from this difficult situation and situations that they've been through. So thank you for your time today. I hope our paths cross one day. And if you have any questions, feel free to email me at Tammy, Tammy, at the instituteofchildpsychology.com. The trauma course that we offer through the Institute of Child Psychology is really about fostering an understanding for parents and caregivers and professionals, because trauma is really complicated and we really try to break it down. So we really hope then people have direction and they know what to access next and what the next steps are to help a child who is struggling with this.
I see, especially within the school systems, and with my own children having gone through the school systems, if we're uninformed, it can magnify things and it can cause more trauma.
People who have come through this course or taken the online training in our trauma on children, finding a way through, have told us that it really opened their eyes as to why children were acting a way they did. And all of a sudden they maybe see their child for the first time. They really see through the behavior, and they then can respond in a healthier way to the trauma.
I think she's an amazingly talented public speaker. I felt it was interesting. She, used personal experience, which really helps.
My hope for people moving forward is they become trauma informed. Trauma is a really complex childhood issue and it's pervasive. We see it under so many different circumstances. So developing awareness and facilitating resources for parents and professionals is so important that for the cause of our organization.